is actually it's a type of germ whereby it's in a family called mycobacterium. So you have a lot of groups of germs that's under this group of family. So we have Mycobacterium tuberculosis complex. This is the germs that actually transmit the disease of tuberculosis. We also have some other sort of like genus whereby it's like causes leprosy, right? And these are the few of the examples of the germs that is inside this genome of the mycobacterium. So it's actually a non-motile germ, and it's the acid-fast bacilli. We call it bacilli. Bacilli is something like a rod. It looks like a rod, okay? And it's like oxygen. We call it aerobes. Aerobes meaning they form of oxygen. Anaerobes, they not form of oxygen the other way around. So, and its size is very, very small. It's only about 2 to 4 micrometer, and a lot of time it's a very, very slow form of like a germ generation. Like this is grow very, very slowly. It goes up to like 15 to 20 hours, right? And the cell it has a wall. The wall is called mycolic acid, and this wall is very, very special. It's actually resistant to drying and also to chemicals. That's the reason why it's very, very infectious. Germ is airborne. We call it what you call when they have it's dried up. When the person cough, sometimes the germ actually is just spread over your environment. It can be on top of the table. It can be just on the air, everywhere. So sometimes it's dried up, and then when the winds blow, and then it's actually going into the person's respiratory tract, and that's how the person is got infected. When you stay with a person who is infectious, for instance, the patient has tuberculosis, active tuberculosis disease, you are prone to get transmitted. The longer the period you stay with a person, the higher the chance you get the infection. We have medications to treat tuberculosis. In the past, way in the 1960s, they don't have any form of proper antibiotics. They only give, sometimes they do surgeries, right? And also the surgery is basically just to take off part of the lung, which is infected with the tuberculosis, right? That is in the past. As you know, this germ is actually form of oxygen, so most of the time it's actually infect the upper part of the lung. So what all these people do in the past is basically they just collapse the upper part of the lung, or they take out the diseased lung so that they can cure the disease. That's during the era without any antibiotics that actually works to kill the tuberculosis germ. But nowadays we have a lot of this chemotherapy or antibiotics that actually can sort of like treat this tuberculosis. So we have 4 types of active drugs that usually used to treat tuberculosis. So those drugs are called isoniazid, rifampicin, pyrazinamide, and ethambutol. So these 4 drugs are shown to be effective in treating this tuberculosis. And the duration of treatment, it can be 6 months. It depends on how complicated the case is. And sometimes if the case is complicated, like for instance, it affects the brain or even the bone, you have to actually treat a bit longer. Sometimes go up to 9 months to 1 year, right?
Okay, so
to diagnose whether the patient has tuberculosis, the main thing is you have to ask whether the patient has that symptoms or not. Most of the time, the patient will come in with a fever, cough, weight loss, poor appetite, and also they have sweating at night. This is a sort of like a cardinal symptoms of tuberculosis. If these people have such symptoms, then only we sort of like examine the patients and find out whether he has any abnormal signs or not. For instance, they can have actually lymph node enlargement over the neck, and when you examine the lungs, you may actually find some abnormal breathing sounds. Right? Those are the clinical features of a tuberculosis. So, as to confirm the diagnosis, first of all, we actually need to get some microbiology samples from the patient's phlegm or sputum. We call it sputum, right? So you need at least like 2 samples, right? Early morning samples, whereby the patient's the what you call the bacterial load is higher during the early samples morning of the sputum. Okay, so that will actually helps you to diagnose. The other thing is you have to get an X-ray done. So you get a chest radiograph to show whether any abnormal radiological features. Right? These are the 2 main things you need to do. Yeah. So we have to detect the disease early, and also we have to treat the patient as early as possible so that the disease is contained and it's not spread to more people, right? And of course, those people who actually stay around with this index case, the person who has the infection, needs to be screened. They need to be sort of like investigate if, let's say, they have symptoms. If all these person who stay with these patients who also have symptoms, and they are investigated and they found to have tuberculosis disease, then they also need to be treated. This is how we contain the disease. And of course, as what I've mentioned just now, if your immune system are strong, you sort of like you contain the disease and it's not causing an active disease. And but you have actually exposed to the germ, and the germ actually stay dormantly in your body. It's just waiting for time for it to be reactivate and causes the disease. So these patients, they won't have any symptoms and their X-rays are normal. But when you do a test to find whether they have this TB exposure, the test what we call is a tuberculin skin test, right? And also another test, the blood test that we call what you call interferon gamma release assay. Okay, if that's these 2 tests actually shown that the patients have this positive test, so it means that the patient most likely is exposed to the TB germ, and the TB germ is actually staying dormantly in their body, and it's just waiting time for it to reactivate. Although the chances of them to reactivate will be 5 to 10% in their lifetime, but there's still a possibility. Alright, so and if let's say we're able to detect these asymptomatic patients, we actually can treat them. Yeah, by treating them also we will sort of like prevent them from getting an active disease. And of course, when we prevent them from getting active disease, we also sort of like contain the disease and halt the spread of the disease. So as you know, Malaysia is very sort of like a moderate to high incidence of tuberculosis in our population. Then there's a lot of this what you call migrations from the neighboring countries, and a lot of time the neighboring countries will actually brings the disease to our country. So it is very difficult to sort of like prevent the migrations, but the main thing is to help in sort of like reducing the impact to our economy. So I suppose the best is to have a good TB control program in our country, so that it will actually prevent from this neighboring country who has patients with TB to come into our country. So as you know, when we want to treat a patient with active TB, it costs hundreds to 1,000 ringgit just to actually treat and cure a patient from a tuberculosis. If let's say the patient has a multi-drug resistant TB, it may cost up to few thousands or even 10 to 20,000 to treat the patients. So the impact to our economy is huge. So we should actually have a good TB control program to sort of like stop those migrants with TB disease to come into our country. There are ways. So usually we have this screening program on all these migrants to actually prevent them from coming to our country if let's say they have an active TB disease. Yeah, and of course, second will be to our social and health sector. So definitely when you when you have the disease, a lot of time you will be sort of like isolated. A lot of people do not understand TB can be treated and can be cured. Alright. So and you have the stigma of being isolated. So a lot of person they sort of like do not want to seek treatment even though they have the symptoms, and they will actually prolong the what you call or delay the treatment, because it's sort of like a stigma to the population that if you have a TB infection, you're going to spread to me and it may not be cured. So this is a wrong sort of a concept within the populations, and therefore we need to educate all these people regarding the TB disease, and this is how it's spread, and we need to detect it early and treat it as soon as possible to prevent the spread to other people. As for our health sector, as you know, we spend a lot of time and also workforce and money to prevent and also to treat TB infections. So we have a very good TB program in Malaysia, and it's actually we are spending quite a lot of money on the health sector to do these preventive measures. Yeah.